do this here. That's the right chair. Okay, so thank you so much for inviting me to do this today. Nutrition and lymphedema, I feel, is a topic that dietitians certainly are not trained in, and there is some reason for that. And by trained in, I mean through our traditional 4-year education. It's not something that's brought to the forefront. But what has become more and more evident is that there certainly is some application. And it's through the cornerstones of science and through understanding of how lymphedema works. And what I brought to you today, and this is what she was referencing as the interactive component of my presentation, I really wanted you all to be able to lead where we're headed, because these are the 6 cornerstones that really are identified as being how we can impact, how we can manage and control lymphedema. So I wanted to open it up and let you all lead this this presentation as to where we go, because there isn't one piece of these 6 cornerstones that is necessarily more important than the other. So is there a place anyone would like to start?
What salt? Can you talk a little bit about salt? I mean, you're talking about regular old table salt?
That's right. So let's start with salt. The question with salt is whether or not it would help as far as restriction. And a lot of times what we find with salt, we're talking about sodium chloride with table salt. And the question is would it help? And the answer is maybe. And it really is dependent upon whether a person is salt sensitive or not. And I don't know about you all, but some folks, if you have a really salty meal the night before, you might wake up and experience, obviously with lymphedema, a little more fluid than you would have maybe before a high salt meal. But I can tell you, even myself, I know that I'm salt sensitive in terms of things like blood pressure and also just the tightness in my tissues as to how much fluid is being accumulated. The basis for this is based on salt and water. They like one another a lot molecularly, and they bind to one another, and they hang on to one another. And so the thought is if we reduce the amount of sodium or salt in our diet, then perhaps we may see a difference in our lymphatic volume, oftentimes in our circumference as far as our limbs go. But the question is how much is too much? Does anybody know what the guideline is as far as how much salt we should be taking in a day, or how much we shouldn't go over?
I don't, and I know mine, I wasn't getting enough at one point, but I don't know what the...
Yeah, and that's also another reality. So the guideline is actually 2,300 milligrams a day. That's where we are as far as a cap, if you will. It could be as low as 1,500 milligrams a day. So a 1.5 to what we call a 2.3 gram sodium window is where we should be, dependent upon how salt sensitive you may be as an individual. What's relevant to know, if you do any kind of home preparation of meals, is that a teaspoon in and of itself is 2,300 milligrams. So that puts you right up against that maximum amount. But where do you think the average individual's consumption is in terms of salt?
Like 5 times that much?
It's actually 150% of that much.
Wow.
So 3,400 milligrams a day is about where we are as the average consumer of sodium-containing foods. The trick is that we need to be looking at our nutrition facts labels. So when we look at those labels, it is important that we're identifying foods that are high in sodium. Anything that is boxed, bagged, or canned does tend to have salt as part of its preservation. And so a lot of times that can make those foods higher in sodium. One of the other things to be mindful of, I've had this conversation twice this week, is that the herbs and seasonings that we're using that are dried, your dried powders, things like garlic salt or onion salt, they are salt. And so they do contribute sodium to the diet. So being mindful of that and maybe making the switch over to a powder as an option, using fresh herbs and other dried herbs that don't have sodium to them. When we're cooking our meals, does anybody know about where in the meal, if you're preparing, let's say, a stew or a soup, should you use your added salt?
At the end?
Yes, yes. And the reason for that is because with long cooking durations, what ends up happening is the flavor of the sodium is reduced. And so if you're adding a little bit of salt at the beginning and we have this long cooking time and we taste it and the sodium or the salt taste, the perception of that has reduced, we add a little bit more. But the sodium content remains the same. And so that's just one little tidbit when we're cooking soups and stews or anything that has a longer duration, is to do it at the end. And then among sea salt, kosher salt, iodized salt, Himalayan salts, sodium is sodium no matter where you get it from. And that's really the bottom line when we compare those. It is worth noting that measurement for measurement, kosher salt does have more sodium than something like a sea salt. So also be paying attention to that. All right, so back to the home.
I have another question, if that's okay. Were you finished with salt?
I'll go right ahead.
Okay. So you said two things. You said you connected salt and blood pressure. High blood pressure?
Sodium and fluid volume. So the retention of fluid. Are you talking about in reference to salt sensitivity?
Yes.
That is also true. Yes. That is one way you can determine if you're salt sensitive. So you can actually see a 5-point increase if you're following a high salt diet to whether or not you are salt sensitive. You may see that 5-point reduction if you follow a low sodium diet and see if there's a difference there.
Okay, thank you. And I guess the other thing I was going to bring up, which you mentioned at the very end, as I was low in iodine, and I think that came from also being not using salt.
Yeah, and that's a really good point, is that a lot of our foods are fortified in one way or another, because somewhere along the line in our history, we've determined that Americans, based on soil levels and so on and so forth, can run deficient in certain minerals. So that's one reason why iodized salt was a primary source of salt and sodium in this country, because we can run deficient in iodine. That's an excellent point.
Thank you.
Absolutely. Where would you like to go next?
Protein.
Protein. Why do we think protein is relevant with lymphedema? What do we think? Should we restrict it? Should we increase it? Should we just keep it average?
Can I ask what kind of protein we're talking about? Are we talking about bean protein, talking about animal protein?
That's a relevant question, and I'll get to that piece
Okay.
in a minute. But in terms of, let's say, like grams of protein, does anybody have any idea as to why it matters? So our blood volume carries a great amount of protein. And there was some notion that maybe we should restrict protein, because when we consider lymphedema and the content of that fluid, it's high in protein, because we have proteins that are leaking out into the lymphatic system. And so there was this thought of, well, maybe if we restrict protein, then that would be less so. Maybe we would have less fluid that is also flowing into that direction. But the reality is that protein, we have what we call transport proteins. You may have heard of one such as albumin. It actually helps to maintain the pressure in our arterial walls and in our vessels, such that fluid does not leak out. It actually helps to keep the fluid in that vasculature space. And so if we have an adequate amount, we keep that from happening. But if we have an inadequate amount, we can see fluid moving into our interstitial spaces. So that's the big reason why we want to make sure we have adequate protein. The other piece is just that the metabolic waste of tissue breakdown can have inflammatory consequences. And so if we don't have enough protein in the diet, let's say we're not eating as we go through treatment, and so we really end up in a kind of catabolic state, we run into trouble with that as well. So it's not that we need an extra amount of protein, it's that we just need enough. And to your question, Catherine, about what kind, I'm certainly going to advocate that we are moving more towards lean animal-based sources. And part of that has to do with one of the other cornerstones, which is in relationship to fat. But largely also because we really overconsume animal-based proteins when it comes to the typical American diet. So we want more plant-based protein. So that would include things like beans and legumes, nuts, seeds, grains, so on and so forth. And where we do consume animal-based protein, we want them to be lean. We want them to be things like fish or chicken and turkey, lean cuts of beef where they're appropriate, and there's an allotment for that. So when it comes to the what kind and the how much pertains to the RDA. It can also pertain to your body weight, depending on where you are in treatment, if you are in treatment, and the type of treatment that you're receiving. But generally speaking, we're talking about 46 grams for a female, and then 56 for men. And then of course the 0.8 to 1 grams per kilogram of body weight as a baseline for protein intake. And the way you determine your body weight in kilograms is by dividing by 2.2. Any questions here with respect to protein?
Hi, Nicole. I'm actually from Canada. I don't know if I just said your name French or not, Nicole. I think I might have said it the French way. Anyway, this is my first time being here, so I'm super excited that I found this lymphedema group. I'm so excited. I do have a question. So I'm basically almost all plant-based.
Okay.
And I'm just seeing that interesting here that there's inflammatory consequences if you don't get enough protein. And I have had a lot of trouble, and I know you're going to come up with that. There's a gut integrity thing, and that might follow into that part. But is there a chance that you don't eat enough protein when you have lymphedema, particularly if you have it in your stomach? Could it cause IBS or bloating in your stomach from the lack of protein?
I don't know the answer to that question, honestly. If you have a lack of protein, whether that would be a risk factor for IBS, if that's a question?
Yeah.
I don't know the answer to that.
Okay.
I suppose
I'm just
in theory,
I've been like talking to a guy. I was talking to a dietitian in Canada, and we were trying to figure out what's going on. And one of the things was dairy, and the other was gluten. So I've actually removed gluten from my diet, and the inflammation in my stomach has gone down, but was wondering if I wasn't eating enough protein, if this could have been a factor with it too. So anyway.
Yeah, no, but those two things are attributed to inflammation in the gut. So those would be a more likely risk factors for IBS as opposed to an inadequate intake of protein. Okay, yeah.
I have one more question on the protein. 46 grams for a female throughout the whole day. Is that correct?
That is correct.
Okay.
And a typical serving per serving or per serving is 7 grams, just so you kind of have an idea of what that looks like. If you're consuming milk, that's about right. That's about 8 grams in a cup. If we consume animal-based proteins, about an ounce would equate to about 7 grams. In your plant-based foods, oftentimes it's about a half a cup of something like beans, for example, to equate. An egg, for example, would also equate to one serving of 7 grams. And so that's kind of how you can tweak that and map that out. You could also use a whole host of, Calorie King and MyFitnessPal are also excellent resources in terms of getting the macronutrients and the micronutrients of a number of foods that you would be consuming to kind of get that protein measurement. Let's try to get there.
So you said a half a cup is how much? A half a cup of plant-based, because I'm like Linda, I'm plant-based.
So for example, like with beans, a half a cup of beans would equate to about a serving of protein, which would be about 7.
About 7.
grams.
Okay. Thank you.
Yeah. All right, where are we headed on the map?
I'll pick hydration if everybody else is being quiet.
Yeah, thank you. So with hydration, the other thought with things like with just edema is, and a number of other health conditions, is to restrict the fluid. But the reality is that when we look at lymph protein concentration, if we are restricting the amount of fluid that we're taking in, the body is going to try and then compensate and then hang on to or retain more fluid. And then when we lift any type of fluid restriction, we're going to end up in a trouble. It's going to overcompensate and we'll have more fluid. So when it comes to fluid intake, we want to make sure that we're just getting adequate intakes, adequate levels. Now, I'll tell you that when we look at the Institute of Medicine, the 2020 to 2025 dietary guidelines for Americans, we're talking about 2.7 to 3.7 liters a day. Now, most of you should be going, whew, I would imagine, because that's a lot of fluid. And that equates for all the fluid that's in your diet. That is not just the liquid in which you consume from beverages. So how do we parse? Go ahead.
Can you tell me what that is in ounces? The 2.3?
Yeah, 2.7 is about 45, no, that's 60, that's almost 80 ounces a day. Maybe a little over.
Okay.
I can do some fast math on my phone here. Yeah, that's about 85 ounces a day at 2.7. That's females, and 3.7 is for males. Now, that said, it may be more reasonable to look at some of the other applications of fluid in terms of calculation guidelines. We use 1 milliliter per kilocalorie of estimated requirements for your intake. So if you're on an 1,800 calorie diet, we're talking about 1.8 liters of fluid that you would consume by mouth. Because again, this 2.7 to 3.7 is certainly a guideline that's written out for also your foods that you take in. So if you had soup, that counts. If you had some type of frozen dessert, that counts. If you had a stew, that counts. Anything that has liquid in it does contribute to that 2.7 to 3.7 liters a day. So just be mindful of that. Okay. And then when we talk about hydrating, we are also making sure that the beverages that we're hydrating with are not acting like a diuretic, because those can be counterintuitive. So things like coffee and alcohol, or things that contain caffeine in general, can pull more fluid off of you.
I have another question.
Let's hear it.
Can you drink too much water? Let's just go with water or green tea. That's pretty much what I drink in the day. Can you drink too much of it? And a chiropractor just told me the other day that drinking some coconut water, for example, Linda laughs, would help the absorption, and that I may be drinking too much water and it's just like passing through. Do you have any thoughts on that?
Well, sure. So you actually can metabolize or process upwards of a liter of fluid in an hour. So that's what the kidneys are capable of. So I'll just tell you that. Can you overhydrate? Absolutely. So if you were going beyond that within a confined time frame, then absolutely. So certainly space it out first and foremost. Overhydration really gets you into more trouble when we're talking about electrolytes, which is why he's bringing in that coconut water piece, because there's this thought that it's more hydrating, and technically that can be true with respect to how our gut actually absorbs the electrolytes that are within coconut water. And so I think keeping a good variety, so coconut water is appropriate, keeping in mind just how much of a carbohydrate content is coming with that. Okay.
Okay. Because I drink about 120 ounces a day of water, or between water and green tea. And I'm about 110. I weigh about 110.
Sure.
So.
And that's certainly above that, right? So above the 2.7 liters a day. Yeah. And that's the other piece, and I talk about this really in the wrap up, but certainly if you are keeping logs of the things that you're doing and you're maintaining hydration within that level, that's fine. We just want to make sure we're not restricting, because what one person is able to maintain, I have folks that are able to maintain their hydration. They're like, I drink maybe 4 cups of water a day or 4 cups of fluid in general, and they are hydrationally balanced. Whereas I can have other people, it sounds like, such as yourself, who is consuming much more, and that's where they've reached their hydrational balance.
Okay, thank you.
Yeah. All right. Where are we headed from here?
Let's do body mass.
Okay. And this is probably where the most evidence comes from with respect to nutrition. And I think it's probably one of the biggest reasons we're even talking about nutrition with respect to lymphedema. It's where the most literature comes from, though there's not a lot of literature. I think I probably should preface all of this with that when I was talking about how dietitians are trained. A lot of this is based on practice guidelines, experience with clients, and also just science and how we know anatomy and physiology work. So that's of utmost importance. And I put body mass as opposed to body weight because really a lot of this has to do with the actual composition of our body. We are made up of, 4 main components. That's muscle, bone, fat, and then obviously other, or what, is sometimes related to fluid. But we know that with excess adipose tissue that there's the theory that there's an increased compression of the lymphatic vessels that's causing some of the impairment. So the literature that has been done, weight is a risk factor, but what's of really great importance is that we're controlling weight, that we're controlling body mass, so that way we're not gaining. There is some improvement when we talk about body mass or body weight reduction. And that can be done through the 2 main things, which is where diet and lifestyle comes into play, and that's moving your body. Now, when it comes to physical activity, I'm exclusively deferring to your professionals here. Certainly certified lymphedema specialists, physical therapists, your physicians, and getting direction from them, because you can do more harm than good if you're not doing the right things. I certainly recognize that. But when it comes to diet, all three of these modifications, calorie restriction, fat restriction, and fasting, each of them can be beneficial in body weight reduction. With respect to calorie restriction, we're trying to take calories in and making them equate to calories out. And then making a reduction maybe by 500 calories a day, let's say. That's in theory an equation to about a pound a week. That's the attempt there at calorie restriction. There has been some benefit with that. We have seen a couple of clinical trials that have really shown us changes in measurements with respect to lymphedema. And then fat restriction, which we haven't spoken about fats yet, but fat restriction can also play a role as part of that. Maybe a little more in theory, but keep in mind that fats also correlate back to your calorie intake. So you're just shifting your macronutrients a little bit. And of these three, I would say probably the most interesting to me and seemingly the most promising is this fasting, this intermittent fasting attempt at a 16-8, where the amount of time in which we are eating is restricted to an 8-hour window. We typically eat in a 10 to 12-hour window. And when we think about your gut-associated lymphoid tissue, or when we look at lymph volume, what we see is that volume is at its greatest after a meal, and particularly a meal that is containing fats. And so the thought is that if we can restrict the amount of time in which we are giving your intestines the opportunity to absorb more, then perhaps we can restrict or control volume. So the 16-8 ratio is probably showing the most promise. The other piece of that is that just in terms of health overall, that type of modification, diet modification, shows the most promise, and not just in reduction in body volume, but also in things like inflammation and insulin resistance or insulin response.
Question.
Yes.
So the 16-8, when do you have a suggestion of when you would recommend when you like break your fast and start, or does it matter like when you started, or is it better to like finish it at say 6 o'clock and start eating at 10 o'clock? Like what is the best for?
Yes, it's actually the recommendation is to do that overnight fast. So that is a part of it. And then consuming your first meal later and stopping earlier. So that is the recommended approach to that. And again, this hasn't been entirely sussed out. That's the other challenge with intermittent fasting, is that there's also 48-hour fasts that are in the literature. There's the 16-8 fast that's in the literature. There's intermittent fasts within the 16-8 fast as well, so you can break that up. But again, when it comes to lymphedema, the theory again is just about reducing the amount of time. So even if you did that in between, there's still some thought that that may prove beneficial as far as the burden that is seen with our intestinal lumen and just what's being leaked out into the body.
Thank you.
Mm-hmm. Okay. We're down to 2. Does anybody remember where we are?
About fats and sources.
All right. Here we go. All right. So fats and sources, just how much are we talking about? The whole purpose for fat being part of a reduction approach, which I mentioned earlier with diet in respect to body weight, is because the way in which we absorb fats into the body. Fats are broken. You've probably heard of, of inflammatory fats. You've probably heard of, omega-3 fatty acids, that sort of thing. But really, when we think about fats, when we're talking about the lymphatic system, we're looking at chain length here. That's one of the things we're really interested in. And there are certain types of fats that will bypass your lymphatic system entirely. And those are your short chain and your medium chain fatty acids. The challenge is that your fats don't come in those chains by themselves in food. So it's not like you consume a food source that would just deliver you MCTs by themselves. Now you could get a manufactured MCT, medium chain triglyceride, or medium chain fatty acid. But the reality is they don't come that way. And so what's important is that your fats and your fat source are thought of in terms of calories and also in terms of balance. So what kinds of oils are we using in our cooking and that sort of thing. So a few studies, really rather limited. They're not quality studies. Some of them are case reports, but they're looking at a 15 to 20% of calories from fat And earlier I mentioned that your calories are just a mathematical equation of fat, carbohydrates, and protein, okay? And so if you know just how many calories you're aiming for or how many calories you are taking in a day, I would advocate as a dietitian when we talk about keeping our patients safe that if you're approaching this, that you're staying on the 20% side of things. Because you can run into what we call essential fatty acid deficiency. And so staying at that 20% level is really where we want you to be. You do that by taking 20%, so 0.2 times your total amount of calories. And then you would then take that number and divide it by 9. And that would give you the number of grams. And so for example, that would be 40 grams of fat per day on an 1800 calorie diet, or 33 grams of fat on a 1500 calorie per day diet. So that's kind of where we are as far as guidelines on just how much to fat. And then I mentioned the different types of fat in the diet and why it matters when we're talking about what we're absorbing and its implication within the lymphatic system.
So I have a question around keto, because keto is going to increase fats. You mentioned MCT, so MCT oils that's added to food and stuff like that. Is that then not recommended for somebody who suffers from lymphedema?
The general consensus, so there are a couple of things, so that's right. The general consensus is that we just don't have enough even science backing from a literature standpoint, but also a theoretical, physiological understanding backing to support a keto diet right now. And that's really where we are. We're just kind of waiting to see how that pans out. When we talk about a traditional keto diet, it is very high in fat. We're talking about 70% of fat for the day. And as a dietitian, especially in the oncology realm, I'm constantly thinking, especially when we talk about survivorship, I'm constantly thinking about what the other risk factors are when we talk about health, and they're just a number. So making sure that your bowels are moving efficiently, concerns for cardiovascular health. There are just some of these other risk factors that come into play after folks have been through treatment that right now just am not able to get behind a keto approach for lymphedema. And a number of other approaches, a number of other, for things like weight reduction and that sort of thing. The other piece with keto I often find is that folks are doing kind of a modified keto. And sometimes we just see that the carbohydrate consumption, just the reduction from refined sugars, from added sugars, that in and of itself has really had a good benefit on someone's overall health or their weight management. And so I think if we're doing something modified, that might be a better approach, but not a traditional keto when we're talking about 70%. Now, we just don't have, again, the theoretical science backing nor the evidence to support it at this point as a recommendation.
Thank you.
Yeah. But what I was saying with our oils is that our vegetable oils tend to be long chain fatty acids when we're looking at what's in the types of fats that we're consuming. So you think about vegetable oils, corn oil, omega-3 fatty acids like olive oil. Those are long chain fatty acids. And so you might be thinking, well, I thought those were good and healthy fats. And they are, because they are essential. So if we're using the base of our intake, if it's predominantly, some of these MCT providing oils like coconut and palm oil, and we include some heart healthy oils like olive oil, that's certainly appropriate, because again, we do need some of those components. You can get omega-3 fatty acids from other places too. So you can get it from things like chia seeds and walnuts and that sort of thing. So just making sure that we have a good balance of fats and fat sources, but that we're swinging more perhaps to a restricted amount from calories first and foremost, and then maybe pursuing coconut or palm oil as part of what we're cooking or preparing our foods with. All right, so the last piece here is gut integrity. And I mentioned this earlier, you know, our gut-associated lymphoid tissue, or what we call GALT, is the gateway into our bodies. And I had a professor explain, you know, our body as, you know, from the time that we take in foods, the time that it leaves our body, it's still on the outside of our body. Okay, so he explained our body like a donut, which is maybe a bad example, but when we take foods in, they don't actually enter our body until we bring them through our mucosal, our endothelial layers in our gut. And that serves as the basis for things like our immune function and what we're taking in when it comes to the lymphatic system and how we're processing and digesting nutrients and fats. So it's important that we support the junctions, because as we have good foods in our diet, things like, and I'll mention them here, but plant foods like prebiotics and probiotics, we're supporting tight junctions of that gut-associated lymphoid tissue, so we don't have things leaking between them. And we're also supporting the villi, so the microbes that are there that also act essentially as a defense, as we're learning more and more about prebiotics and probiotics. Prebiotics are the foods that feed the microbes in your gut, and probiotics are the actual microbes in your gut. It's the healthy or the good bacteria that we can provide. And the more diversity that we have, the better. And how do we do that? We get that through things like fiber. That's that probiotic or prebiotic piece. The guidelines on fiber are 25 to 38 grams a day. But I'll tell you, in the GI world, we're talking about species more particularly, as opposed to, let's say, even macronutrients or grams per day. So the bigger of a variety that you can give your diet, the better. And some of those prebiotics I have listed here as a couple examples, like garlics, onions, asparagus, bananas, and leeks. And then probiotic foods, you know, kefir and yogurt are probably the most commonly known. I would say people would cite those as being a probiotic containing food. But what's also really interesting that we're finding is there are probiotics everywhere, as you likely know, on your skin, in your mouth, and each of these have their own ecosystem. And again, this goes back to the variety of species that we're taking in a day. There are probiotics, there are microbes that live on the outside of our plants and within our plants. And so consuming them is also contributing to the biodiversity in our guts. So again, you know, those are just some ways that we can really help with our gut integrity. Because with an impaired lymphatic system, we know that we can have impaired immunity as well. And if that's our greatest defense, that's one of the biggest reasons why we want to certainly promote good gut health and gut integrity. And you might be wondering why I listed sauerkraut and kimchi. And that's because they are great probiotics. But why would I be concerned about them?
High in salt?
Yeah, it's the salt content. So those two foods are pretty high in sodium. And so that's just kind of goes to show, when we talk about foods that are in a healthful category or are good for us, it's really important to be mindful of the other aspects that some foods can be bringing to the picture. And sodium, as we talked about earlier, is one area we just want to make sure that we are falling within the guidelines on. So where do we go from here? There are two big things that I talk to everyone about, and that's consuming more plant foods and preparing foods in the home. Those are the two biggest things that we can do. I like to really focus on the changes, you know, focusing on what you are doing, focusing on what you can do and what you can improve rather than the things that maybe are not going so well, or the things that we need to restrict a little more of. If you know what they are, that's great. That's part of this last point of being realistic and setting SMART goals. But if you start with consuming more plant foods and putting that at the base of your diet, um, there are some misconceptions on what, plant-based diets are. That does not mean you need to be a vegetarian or a vegan. There's still room for animal-based proteins, but the base of your diet should be plants. It should be whole grains and fruits and vegetables and legumes. And the minute we start taking back control and preparing foods in our homes, you'll see a lot of things happen. Reductions of added sugar and salt and emulsifiers that are in our food, and we know those are not great for our gut health. So prepare foods in the home. People will ask me, well, what kind of yogurt is the best yogurt to consume? I'm going to tell you the most plain, simple yogurt you can find, and you'll probably make this face at me, but I'll tell you from there, then you take the control to add something to it. So maybe you sweeten it with berries or your own vanilla, or maybe it's honey. Maybe you are adding a little bit of sweetener in that space, but you're controlling just how many grams go into that and what it requires for you to find the palatability with it. So take foods back into the home. And then food logs and journaling. We talked earlier about the amount of fluid that it requires to hydrate someone adequately, and what's for one person and another may be different. Another example of that is the sodium and the salt sensitivity. For some folks, calorie restriction just doesn't get it for them. And so if you're keeping food logs and you're journaling your symptoms, it's going to give you a better picture of where you can make tweaks and adjustments to achieve the outcomes that you need to achieve. And then again, like I said, being realistic and setting SMART goals. I'm a big fan of SMART goals. If you're not familiar with them, certainly look into them. It's really about getting very specific, measurable. Is it attainable and realistic? Is it timely? So you're really setting some parameters on the things you're looking to achieve, so that way you can check in with yourself and then maybe reward yourself, maybe expand upon it, because what your ultimate goal was maybe was loftier than what was realistic. So you scaled that back just a little bit to get there first. And that's the big framework over everything that we discussed today. There is no lymphedema diet. It's really, like I said earlier, it's really just the understanding of science and physiology, and just what kind of impacts nutrients tend to have on the body, and when there's injury to our lymphatic system.